Can you give me one word to describe Obamacare?
I'm going to plead.
I mean, you can elaborate if you want, but you know, if you had one word, what would you say? I mean, you're in management, right? So you know a great deal of it.
Yeah. The system that I work for, we kind of ignore it.
Okay.
We kind of bypass anything. So Trump care, Obamacare, doesn't really matter what care it is.
What precisely is your specialty? What is that?
So we are the first hospital in the country that you don't need insurance. You can pay things like you'll know what the cost is before you do something.
Interesting.
So
is this
a hospital network? It's called St. Luke's University Health Network. So, like, if you go into the ER in a normal hospital, and you don't know what your bill is until 3 months later, and they give it to you. Where at St. Luke's, they'll say if they know you don't have insurance, if you don't want to get your insurance involved, they'll say, okay, we'll be able to give you like a 70% discount from what we submit to the insurances.
Now, is this a alternative to Everything. This is and you are part of this.
Yeah. So I work with blood work. So I'm able to. We had like a patient where their deductible made them pay like $1,700 out of pocket, where if the actual cost of the blood test was only $80. So we tell them the cost for us is $80. If you give us $100.
Is there a website, or is this local, just in Pennsylvania, or is this?
Well, there's a lot of other companies that are doing it. You can Google it. It's called the Consumerist movement of healthcare. Consumerism, and a lot of hospitals are starting to do it. We're by and large the biggest that's done it, but yeah.
And how is it? Who started it? How it funded?
It's completely self-funded, so it's completely. We don't get any form of third payer systems out of the way. It's completely basically cash and check from the patient, as if when you go into like a TV store and you buy a TV, you go into the blood work, you go into one of my offices to get blood work done, you pay for 3 tests for $50.
This sounds to me about as close as I could imagine getting to being a free market. Am I correct here? This is very good.
Yeah. Google, it's like either the consumerist movement or consumerism healthcare.
And you're on the opposite. What do you do?
Yeah, I have to abide by whatever my patient's insurance are, but I don't get involved so much as to what I provide the therapy.
Yeah, you're there to help people. You know.
I let other people deal with Med B, Med A, Medicaid.
Yeah, more of the hands-on. What I've gotten from a lot of people who are, more like nurses who really want to help people and things like that, is that the bureaucracy got in their way, dotting all the I's, crossing all the T's, making sure that, because everything was about, you could be sued, or you wouldn't get paid, or
It gets in our way in that sense, where they call it CYA, cover your ass.
Yeah, right, yeah.
But it also gets in my patient's way too. If they have a poor insurance, we might not even provide the services that they really need because of their insurance.
Now, does Obamacare, has that affected your end at all?
Not really, no. But I work with more of the geriatrics, so it's all under Medicare and Medicare A, Medicare B, Medicaid.
It's great chatting with you.
Oh, thank you for your information. Now I know something I didn't 5 minutes ago.
I think it's the future of healthcare.
I think so. Thank you very much.
Have a great day.
Yourself. Here's a get out of jail free card from Hillary Clinton. This is good for any crime in the world.
Oh my God.
Malpractice, anything. You want to murder people, doesn't make any difference. They will get you out of here.